A family vacation turns tragic when a beloved grandfather suddenly collapses.
Maybe he was feeling bad, but didn't want to tell anybody because he didn't want to ruin their vacation.
And things get complicated when his family objects to an autopsy.
Honestly, at this point, I don't know what to think. I got the family not wanting an autopsy on one side, but on the other hand, I've got 20 years of experience saying this isn't adding up.
And then, a seemingly healthy woman dies without warning.
It is truly a mystery that this 39-year-old perfectly healthy woman just drops dead for no reason.
Now it's up to Dr. G to put the pieces of a very unusual puzzle together.
We gotta dig a little deeper here. What's going on?
As chief medical examiner of the District 9 morgue in Florida, Dr. Jan Garavaglia's hours are anything but 9 to 5.
It's a long holiday weekend, and I was actually expecting the worst today, but that's still to come, I think. So only 2 today, but we're expecting more the rest of the weekend.
One of the bodies in the morgue today is a retired schoolteacher from Arizona named Philip Green.
This is a 78-year-old man that's on vacation here. He's visiting his daughter who lives here.
But little did Philip know, this trip would be his last. It's early afternoon on a Friday, and Philip, along with his wife Nora, is enjoying the day with his daughter Maddie and her 2 children.
They've been out doing a lot of errands, sightseeing. They've supposedly been having a good time.
But as they make their way through a park in downtown Orlando, Philip takes a bad step and falls to the curb. Fortunately, the 78-year-old appears uninjured. But right away, he does complain of some abdominal pain. So Maddie and Nora insist he go home and at least try to get some rest.
He went home to his daughter's house, didn't do much that evening.
But as the hours pass, Philip begins to feel increasingly ill.
He didn't seem well. He seemed sick. He has abdominal pain.
Although Nora's concerned, Philip insists it's just a stomach bug and that all he needs is a good night's sleep. But just as he's about to lie down, the 78-year-old collapses to the floor, unconscious.
Oh my God. They call 911.
Sir, can you hear me?
EMS immediately took him to the emergency room, but they really couldn't revive him, and they pronounced him dead.
The next morning, Phil's body arrives at the District 9 morgue. Now it's up to Dr. G to find out exactly why he died. Except there's a problem.
The family clearly didn't want an autopsy. They didn't feel an autopsy was necessary, and they cite religious objection.
In fact, the Greens are devout Jehovah's Witnesses and do not believe in autopsies. And while there's no official church mandate against the procedure, Nora simply wants her husband to rest in peace. In an effort to honor her wishes, Dr. G will now attempt to determine Phil's cause of death without performing an autopsy.
Not everybody that comes through my morgue has to be autopsied. If you have a known medical history, if you die in a way that we would suspect with that history, we could sign that out, and it's not a problem. We often do that for people who are visiting from out of town with very serious medical problems.
With this in mind, Dr. G begins a careful review of Phil's medical records and right away finds something that could explain his death.
He's had a heart attack about 5 years ago. When you look at the EMS sheet, they really suspected with his history that it was the heart attack.
Each year in the U.S., an estimated 450,000 heart attack survivors suffer a repeat episode. And what Phil thought was just a stomachache may have very well been a symptom of another attack.
Abdominal pain can go along with a heart attack. I have autopsied more than one person who came in here with abdominal pain and ended up having a heart attack.
Based on this history, it appears she may very well be able to honor the family's wishes and avoid a full autopsy.
And I thought, oh good, I can sign this case out.
But just as she's about to close the book on Philip Green, a notation in the investigator's report catches her attention.
He never was quite right that evening. He has confusion and then mental status changes where he's totally out of it. So it could be something just in his brain.
According to his wife, Philip's abdominal pain and confusion began immediately after his fall.
That makes me worry. Maybe he has some type of blow to the abdomen that's causing problems.
Now, with multiple suspects at hand, Dr. G is facing a tough dilemma.
Honestly, at this point, I don't know what to think. I got the family not wanting an autopsy on one side. I got a history of heart disease. I got the hospital saying it's probably a heart attack. But on the other hand, I've got 20 years of experience saying this isn't adding up. The more I read, at least I want to look at him and see what's going on. He looks good.
Yeah.
He really looks good. For 78 years old, he looks great. He looks younger than the stated age of 78, which is a wish of mine when I get to be 78.
Dr. G begins the external exam, searching for signs of head trauma. But she doesn't see any overt cuts or palpable bumps that would suggest a serious injury.
Alrighty, doesn't look so bad.
Next, she moves on to Phil's body.
I notice that he does have some trauma. He's got a big bruise on his arm, a little scrape on his elbow, and a bruise and a scrape on his knee.
But Dr. G quickly determines that the wounds are superficial and not in any way life-threatening.
I mean, if he looks completely normal, there's nothing that looks odd, you know, I'll think about signing him out.
But as Dr. G and her assistant, Brian Mahalski, remove what's left of Philip's clothing, she gets her first good look at his lower abdomen. And right away, she's convinced that she won't be able to sign this case out after all.
I take his clothes off, his boxer shorts, and I'm not so sure the hospital noticed this. This is no plain heart attack.
Dr. G has just made a shocking discovery in the external exam of Philip Green, a 78-year-old retired school teacher who died unexpectedly while visiting his family in Florida. For religious reasons, his wife Nora is hoping to avoid an autopsy. And Dr. G has been doing her utmost to honor that request.
We really try to work with people who have true religious objections to an autopsy. I have to have really good reasons to put the family through that.
But this latest finding may throw the entire plan into question.
Oh, gosh, okay. He's got a huge inguinal hernia.
An inguinal hernia occurs when a part of the bowel protrudes through a weak point in the lower abdominal wall.
Usually it's absolutely a benign. I mean, it's usually not a problem.
But in Phil's case, Dr. G can see that the skin surrounding Phil's groin and lower abdomen has become discolored.
It's red on the left side, and this redness is on his abdomen coming up from his scrotal sac. I mean, something's going on here.
At this point, only one thing is clear. Dr. G must proceed with the full autopsy.
I do not feel comfortable signing this case out, not at all. So I have to talk to the family. And so I call them up and we talk about it.
Yes, this is Nora.
We talk about the pros and cons of never knowing why their loved one died. We talk about the problems with things that you can find out for other family members, inherited things. So we just talk about the whole gamut of the information you can get from an autopsy, and don't they really want to know why he died?
It's not an easy call for either Maddie or Nora to make, but ultimately, they decide to put their trust in Dr. G.
They fully understood and actually wanted the autopsy by the time I got done talking to them.
So we've got him ready to go.
If I can get the answer to the head, and it's a clear-cut answer, I may not have to do the rest of the autopsy. So I start at the head.
You ready?
I'm going to be looking for trauma from when he fell. I'm going to be looking for natural disease, a stroke, or maybe a bleed inside of his brain.
First, she cuts the scalp from ear to ear, then peels back the skin. And there, she makes an unexpected discovery.
Lo and behold, he does have a bruise to the back of his scalp.
Dr. G now wonders if this might indicate fatal head trauma.
Although they didn't think he hit his head, sometimes you can't tell. Things happen so fast.
Dr. G's morgue technician, Brian Mahalski, cuts through the skull, or calvarium, so she can access the brain itself.
Okay, let's see what we got here.
And as soon as I open up that calvarium, I peek in, and there's no blood.
Nothing.
He could have gotten that bruise on the curb, but it didn't cause any internal brain trauma. And when I cut the brain, there's no evidence of stroke and no evidence of bleeding.
No closer to solving the case, Dr. G is now left with no choice.
We've got to finish the autopsy now. I sure hope it doesn't end up to be a heart attack. I start the Y incision, of course, on the chest. They did say he'd hit his side, and so I'm looking for rib fractures, punctured lungs, anything along that line.
But as her scalpel cuts into Philip's abdomen,
Oh, boy.
an awful stench takes Dr. G by surprise.
It does smell bad.
Something terrible has happened. He's got bowel contents which have spilled into his abdominal cavity. There's clearly something wrong.
Look at that.
Right away, she can see that the bowel contents, loaded with bacteria, have caused an infection in the abdominal cavity, creating pools of pus, inflammation, and dying fatty tissue.
It's a mess in here. I don't know if his hernia is the cause of it yet, but I suspect it is.
It's possible that Phil developed what's called a strangulated inguinal hernia. This occurs when the bowel protrudes into the scrotal sac and becomes twisted or swollen.
The bowel gets trapped into the scrotal sac, and its blood supply gets cut off.
Starved of oxygen-rich blood, the bowel wall begins to weaken and die, allowing the bacteria to leak out.
And then that gets into your bloodstream, and you can die of sepsis.
Okay.
But the only way to know for sure if Phil suffered from this type of hernia is to dissect his scrotal sac. And while it doesn't take long to confirm Dr. G's suspicion,
There it is.
there's an unexpected twist. The hernia itself, though clearly present, does not appear to have been fatal.
The bowel wall itself looks great. There's no perforation, it's not dilated, there's no obstruction. Looks good all the way around. Nothing to do with that hernia.
But if Phil's hernia didn't cause the massive outflow of his bowel contents, what did?
The reason for it was not in that scrotal sac. I have to look elsewhere in the bowel.
This means searching through pus, spillage, and more than 25 feet of bowels.
Oh, wow, that's next. You know, it's one thing to deal with a decomposed body. This is a whole different kind of smell when you have bowel contents that have gone into the abdominal cavity. It's a nasty appearance and it's a nasty smell. This is going to be kind of a tedious, messy dissection.
Dr. G surveys the jumble of internal organs and spilled bowel contents in Philip Green's abdominal cavity.
What a mess.
But there's a step she must take before she can pinpoint the source of the leak.
It was such a mess in there that I really wanted to do the chest first. Give me some more room.
Go ahead.
With Brian's help, she cracks open the ribs and removes the heart and lungs. Given Phil's history of heart disease, her next step is to weigh the heart and dissect it. Immediately, she can see the telltale mark left by the first heart attack he suffered 5 years ago.
From the nice beefy red heart muscle, it's replaced by kind of white scar tissue. So it clearly looks like a scar. And when I look at his heart, he does have coronary artery disease. But all his heart disease looks very stable. Nothing new, nothing acute, nothing that's just happened to him, nothing that would have killed him. Even though he'd had a history of heart disease, even though the ER said he had a heart attack, it didn't really sound like a heart attack to me. I'm glad it just didn't turn out to be a heart attack.
It's a huge relief knowing her initial instinct was correct. But she still doesn't know what caused the infection in Phil's abdomen.
I've got to deal with this bowel.
Let's see what's going on here.
So you start at the beginning. You start, where the esophagus goes into the stomach.
Then she follows the small intestine, noting how it's abnormally expanded or dilated.
It's got liquid and air in it. That's a clear sign that he's got some type of obstruction.
Inch by inch, she works her way along his bowel. Until finally, she hits pay dirt.
Well, look at that.
I've got a 1-inch defect in the bowel. It's open.
See it? That hole?
And the bowel contents are going in to the abdominal cavity. That's not good. What caused that hole? Well, one thing I'm worried about is cancer, maybe eroding through. But when I open it up, there's like necrosis or dead tissue around the hole, but there's nothing that looks cancerous. It truly was completely normal bowel, except for the hole. So my assistant and I were kind of taking this bowel out a little bit at a time.
And then, in a collection of pus, she comes across something strange, something surprisingly solid.
And you're like, what is this hard thing? What is this hard thing loose in his belly?
Dr. G then grabs hold of the object and pulls it out of the abdominal cavity.
It was this round, hard stone.
the exact same size as the defect in the bowel.
It took a second, and then I realized this little stone looking thing is ultimately what killed him.
Now, with the last piece of the puzzle literally in her hand, Dr. G can finally replay the bizarre chain of events that led to Philip's unexpected death. It's a gorgeous afternoon in Orlando, and Philip Green is enjoying his long-awaited family vacation. Or at least he's trying to.
He's got this scrotal hernia that nobody knows he had. That must have been uncomfortable, but ultimately didn't have anything to do with his cause of death.
But something else did. A stone-like object in his intestines called an enterolith.
An enterolith is like a rock that forms inside your small intestine.
They may develop for a number of reasons, ranging from a natural buildup of minerals in the body to problems with the digestive system itself.
They're kind of like gallstones. There's concretions that form on layers, kind of like a pearl, I guess, inside of an oyster. Believe it or not, the most common reason for these things are in the Middle East. It's people who eat persimmons. The undigested persimmon has this vegetable material that kind of sticks together, coagulates, and kind of forms this hard stone. Any veterinarian you talk to knows all about enteroliths because it's a huge problem with horses. If they eat enough alfalfa, the pH of alfalfa is such that it kind of causes these stones to form inside their bowel, and they end up obstructing.
But in humans, they're extremely uncommon. And most enteroliths are very small. So Dr. G is surprised to find that Phil's is nearly an inch wide.
They're not usually get that big, and they just pass through your entire bowel without any problem.
And Dr. G now believes it's been forming inside his bowel for quite some time.
This man's enterolith took a while to develop, days, weeks, maybe even months.
She suspects that the earliest symptom was just a little constipation.
First, his problem was the obstruction. Nothing was getting through.
But as the enterolith grows larger, a more dangerous problem develops.
That enterolith is pressing on the inside wall of the small intestine, kind of working its way through that wall.
Gradually, it wears away the thin lining of tissue.
This was a time bomb waiting to happen.
At this point, however, Phil most likely could have diffused the bomb.
He could have had that bowel obstruction easily corrected.
But Phil doesn't seek medical help.
Maybe he was starting to have these abdominal complaints and really didn't want to tell anybody because he didn't want to ruin their vacation.
And now, on this beautiful day, a minor misstep sends the enterolith on a fatal trajectory.
When he falls and there's increased pressure, kind of pops it out through that weakened tissue. And then clearly, once that happened, the bowel contents leaked out. As that bowel contents leaks into his belly, the bacteria start to multiply.
But the final blow comes when the bacteria infiltrates his bloodstream.
Your body starts reacting to the bacteria. Your vessels start to kind of lose their integrity and kind of get dilated. Your heart starts beating faster. And eventually you can't maintain your blood pressure. You go into shock and you can't provide blood and oxygen to your vital organs, including your heart and your brain.
By the time the 78-year-old collapses on the floor, it's simply too late to save him. With the full report now complete, Dr. G once again reaches out to Phil's wife and daughter.
I think the family was shocked. Such an odd thing. I'm like, didn't he have complaints? I know something is going on with him prior to him falling, and they're like, no, he's really private, he's really stoic. I mean, this is the definition of stoic.
But while both Nora and Maddie wish Phil had shared his discomfort with them, they ultimately find solace in knowing the autopsy wasn't in vain.
They were actually very thankful that I did an autopsy. They were thankful to really know why he died. Oftentimes, people are so afraid to do an autopsy on their loved one. But there, many things you can find out that might help you come to grips with the death.
Dr. G is the first to admit that the majority of autopsies she performs on older patients, like Philip, are relatively routine. But when a seemingly healthy young woman dies suddenly, it will take all of her skill and experience to track down a hidden killer.
I love cases that I really don't know what it's going to be going in. She's healthy, active, 39-year-old woman. This death could be just about anything.
Well, it's a rare treat for me to get out of the morgue, and today we're in Charleston, South Carolina, and it is beautiful here. We've been invited to come up to this company, we're told to look at their surgical lights. We've been told that these lights are very energy efficient.
Good morning.
Good morning. It's important for me because good lighting really makes or breaks an autopsy room.
So it doesn't limit the vertical range of the lights.
I'm looking for lighting for my new green morgue. These lights look good, but there's really only one way to find out for sure.
Nice to meet you. Would you? When's the last time you've been to the dentist?
Oh, no, I'm teasing.
To hold the heart.
Yeah, you get to hold the heart, but look on it, it does have room.
Leave it on our chin.
I don't usually put them back, but we'll put that back.
Outfitting the new morgue properly is a top priority for the entire District 9 team. But back in Florida, bodies are waiting. And one particularly troubling case has gotten the attention of Dr. G. It's a busy Saturday morning, and 39-year-old Judith Kirchner is at her flower shop, meeting with two new clients, a bride-to-be and her mother, about arrangements for an upcoming wedding. But just a few minutes into the consultation, Judith is suddenly overcome by some unusual and frightening symptoms.
She all of a sudden started getting short of breath and having difficulty breathing, and she just collapsed right in front of me.
Oh my God.
You okay?
One of the clients immediately calls 911.
Emergency crew got there. They tried to resuscitate her en route to the hospital, but she didn't make it.
When Judith's only sister, Christine, gets the news, she's overwhelmed with grief.
As you can imagine, her sister was floored. I mean, she's at work, and she starts getting short of breath and dies.
And as Dr. G reads through the investigator's report, she too is bewildered by Judith's death.
It is truly a mystery that this 39-year-old perfectly healthy woman just drops dead for no reason.
But the abrupt nature of the death itself might provide a critical clue.
I suspect something sudden in her brain, something sudden in her lungs, like a clot, or something sudden in her heart.
Still, all theories aside, Dr. G knows that the truth behind Judith's untimely death may not come so easily.
You know, you had sudden infant death syndrome. I have sudden middle-aged woman death syndrome. Because their cause of death are a lot more subtle and take a lot more work for some reason.
But it's this very challenge that motivates Dr. G to find the answer.
I love cases that are mysterious, that I really don't know what it's going to be going in.
Let's see. Quite attractive.
Well, when I first look at her, I noticed something I hardly ever see in my morgue, a dress. I don't get too many people who die in a dress.
Can we go ahead and undress her?
Yeah.
Yeah, go ahead and undress her.
Most of my clientele are hospital gowns or pajamas. So right off the bat, I thought this is going to be unusual.
Next, Dr. G turns her attention to Judith's arms and legs.
Oh, look at this.
When I get to her legs, she's got pitting edema. Fairly marked pitting edema.
Pitting edema is a common form of swelling in the extremities. The pitting refers to the telltale indentations that briefly remain on the skin when pressure is applied.
If you press on it, it puts a little pit.
It may mean nothing, but it can be an indication of some serious underlying medical problems.
Well, there's many things that can cause that. One of the things we look for are maybe kidney failure, maybe heart failure. I mean, she's kind of young for both of those things.
Dr. G records the observation on the body sheet, then turns to examine Judith's head. And as she palpates her scalp, she discovers another abnormality.
Oh, her head's not good.
I feel a small contusion in her scalp.
There is a bruise on the back of Judith's skull. The injury most likely occurred when Judith collapsed at work. But now, Dr. G must contend with another disturbing possibility. What if the blow to her head is unrelated to her fall in the flower shop?
Nobody really knows what she was doing the previous 72 hours. Maybe the day before, the night before, she'd slipped and fallen. I mean, what's going on? I don't know. I'm not going to know until I do the autopsy.
Dr. G's morgue technician, Tom Hemphill, prepares the body of 39-year-old Judith Kirchner for autopsy. The florist died suddenly the previous morning while working with clients in her flower shop.
She just got up, she was complaining of shortness of breath, and then she collapsed. We don't really have a lot to go on, and I'm hoping the autopsy is going to give me the answer.
Just something to hold her head a little bit.
I got it.
But before opening her body, Dr. G wants to further investigate the bruise found on Judith's head during the external exam.
Did she slip and fall earlier in the day or the night before?
Got it?
But delayed head injury, that's not unheard of in a 39-year-old woman.
But the possibility of trauma isn't her only worry.
In this case, I'll also be looking for bleeding inside the brain, maybe from hypertensive disease, or maybe even a ruptured aneurysm. So there are things in that brain that could kill you quite suddenly.
Using her scalpel, Dr. G cuts an incision across the back of Judith's head and reflects the scalp to examine the tissue. And what she sees immediately deepens her concerns about trauma.
I do see the scalp contusion, the bruising of the scalp.
But did the bruise cause her death? To find out, Tom opens Judith's skull or calvarium with an oscillating saw. Dr. G then pries off the skull cap for a closer look at the surface of the brain.
Alrighty.
There's no significant edema, there's no bleed in the subarachnoid space.
Next, she dissects the brain, searching for any abnormalities or injuries.
There's no bleed, tumor, or other abnormalities inside the tissue of the brain. The contusion on her head was clearly from when she stood up with her shortness of breath, and then she had her sudden collapse onto the floor.
But the lack of findings starts to raise her concerns that Judith's death might go unsolved.
I'm not gonna like this case if once I'm done with the autopsy, it's negative. Okay.
Dr. G opens the torso with a standard Y incision. Peeling back the skin, she gets her first look at the abdominal organs.
My initial examination revealed relatively normal appearing abdominal cavity.
You want to get the tox?
So at this point, I go ahead and take my toxicology because ultimately, tox may be the answer in this case. After I take my toxicology, I open up the rib cage in my usual style and lift off that breastplate, and I know something unusual.
Oh, look at that.
Something I don't usually see in the morgue, an enlarged thymus.
The thymus is a small gland that rests just under the breastbone. It helps in the early development of the body's immune system, changing in size as a person grows older.
The thymus gland increases to its largest size at puberty, and then it starts to decrease in size, and by the time you're an adult, it's very, very small.
But in Judith's case, something is clearly wrong.
Her thymus was very enlarged. It was 70 grams, way bigger than we normally see.
And this unexpected finding gives Dr. G her first significant clue.
The first thing you think of when you think of an enlarged thymus, for me, is myasthenia gravis.
Myasthenia gravis is a rare autoimmune disease that severely weakens muscles throughout the body. The disease can cause sudden death, but typically the person would experience symptoms for years.
It'd be very rare, but it's a possibility.
Okay.
Unfortunately, Dr. G cannot diagnose myasthenia gravis until blood tests return from the lab.
All right.
In the meantime, she turns her attention to Judith's chest cavity.
Well, then I want to look at her lungs. As you recall, the symptom was shortness of breath.
On first glance, they appear healthy. But it isn't long before she finds cause for alarm.
When I cut the lungs, there's a lot of pulmonary edema or fluid buildup in the lungs.
This fluid buildup can often indicate serious heart trouble.
So I really need to look at the heart.
Carefully, she cuts into the pericardial sac that surrounds the heart and gets her first glimpse at the organ.
It looks like the heart's enlarged.
That's not good.
There are definitely some abnormalities.
To get a closer look, Dr. G removes the heart and dissects it.
When you cut the muscles appear somewhat soft and there's some pallor to it. The heart looks like it's playing a role in this.
Judith's enlarged, dilated heart, combined with its pale appearance, or pallor, point Dr. G to one undeniable conclusion.
She's dying of some type of congestive heart failure.
Congestive heart failure is a condition in which the heart becomes so weak it can no longer pump effectively.
I know this is why she died.
But this finding raises more questions than answers. How could a young woman who had no history of heart failure suddenly die from the disease?
It's not making sense to me how a 39-year-old woman who's now dying with congestive heart failure, what is causing that heart to fail? We gotta dig a little deeper here. What's going on?
Dr. G has just discovered that 39-year-old Judith Kirchner died from heart failure.
We know she's in congestive heart failure. We know there's something wrong with her heart. But inquiring minds want to know, what is the reason for this? Okay, let's see.
One reason may be atherosclerosis, a buildup of fatty plaque that can block arteries, which over time can damage and weaken the heart muscle. To investigate this possibility, Dr. G carefully dissects the heart's slender vessels and is surprised by what she sees.
Her coronary arteries were actually clean. She didn't have any atherosclerosis.
Furthermore, there's not a single sign of abnormalities or defects that would have led to congestive heart failure.
Right now, I'm not seeing much.
So far, the findings make no sense, and Dr. G is quickly running out of options.
The only thing left is the neck. I usually save that for last.
And as Dr. G slices through the delicate neck tissue, she encounters something completely unexpected.
She has a very enlarged thyroid gland. A normal thyroid gland doesn't weigh that much. Maybe 20 grams it weighs. Hers weighed 70 grams, really enlarged.
The thyroid is a tiny butterfly-shaped gland that sits just below the Adam's apple. But despite its small size, the thyroid has a big job, regulating the body's metabolism.
When I saw her thyroid gland, it gave me an idea.
Putting all the clues together, Dr. G now suspects that the enlarged thyroid may have played a critical role in Judith's heart failure.
But I'm not going to be sure until I look under the microscope and get some of my blood tests back.
She takes tissue samples of Judith's thyroid and sends them to the lab for processing. Now, all she can do is wait. A week later, the microscopic slides finally come back. And Dr. G anxiously puts the sample of Judith's thyroid tissue under the lens.
So when I look at the thyroid under the microscope, all of these kind of subtle, weird things that I'm finding in autopsy are making sense. But before I sign the death certificate, I want it confirmed with the blood test.
She quickly turns her attention to the tox report, zeroing in on Judith's thyroid hormone levels.
Once I get the results, I see that her thyroid hormone was extremely high.
Based on these findings and the enlarged thyroid she saw at autopsy and under the microscope, Dr. G now knows exactly how and why the 39-year-old died so suddenly.
The mystery's solved.
It's just before noon, and Judith Kirchner is meeting with new clients about an upcoming wedding. But today, she isn't feeling quite herself.
She's probably starting to feel a little jittery. She's probably sweating a little bit.
And Dr. G finally knows why Judith feels so sick.
She's got Graves' disease.
Graves is an autoimmune disease that attacks the thyroid gland and causes it to produce excessive amounts of the thyroid hormone.
This thyroid hormone, it affects every cell in your body on how it metabolizes energy. And so with a very high thyroid hormone, you're going to get a very high metabolic rate.
The disease also explains the enlarged thymus gland found during autopsy.
She has an enlarged thymus gland, which is what we often see with autoimmune diseases, particularly Graves' disease.
Autoimmune conditions like Graves can be difficult to decipher, but there are certain risk factors for developing them.
Women have more risk, about 8 times as much risk as men do. Also, there's a genetic predisposition. If someone in your family has an autoimmune disease, then you may be more at risk for developing that as well.
I'm sure she had symptoms days and probably weeks prior to this crisis. The jitteriness, the tremor, difficulty sleeping, sweatiness, the loss of weight, the palpitations.
In the weeks leading up to Judith's death, her body starts making antibodies that stimulate her thyroid gland, causing it to produce more hormone. This chemical imbalance causes Judith's heart to beat harder and faster. And on that fateful morning, the weakened organ begins to fail.
The grave problem with that elevated thyroid hormone is that it causes your heart to beat faster, that it can't even get all the blood out each time because it's beating so fast. Her heart cannot keep pace with that beat anymore. And it's starting to dilate because not enough blood is getting pumped out with each pump. She stands up, she's trying to take her breath, and she collapses. Her heart goes into a terminal arrhythmia, and they can't revive her. Ultimately, she died from congestive heart failure brought on by Graves' disease. It's just sad because she could have prevented her death if she had taken some of these symptoms a little more seriously and sought medical help.
But before she can close the book on the case of Judith Kirchner, Dr. G must share the news with her sister Christine.
When you tell their next of kin that they had a chronic disease that they knew nothing about, they're always floored. Her sister said, I didn't know there was anything wrong with her. Unfortunately, she didn't think there was anything wrong with her either.
When is it healing time? When is it peace of mind?
It doesn't bring them closure, but it gives them a little bit of peace, at least knowing what happened.
Ask questions you're not ready for. I'm already answering them, I say. He doesn't argue. Back at the hospital, Lila is sitting with her laptop, her face lit by its cold glow. Where were you? She asks. The crash site, I say. I needed to see it. She closes the computer. What are you hoping to find? A reason that makes you less guilty? I'm hoping to find a reason at all. She sighs. She wrote one. She pulls out the journal again, flips to the last page. Read. If he tells the truth, I'll listen. If he doesn't, I'll turn. Maybe that's justice. I stare at it. My throat tightens. Turn. The word feels physical. She wrote, turn. Lila nods. She meant the wheel, Daniel. She meant exactly what she did. For the first time, the room spins. I grip the bed rail to stay anchored. She decided, in a sentence, I whisper. No, Lila says softly. You both did, just at different speeds. She leaves me alone with that. Night falls like ink poured slow. I sit by Mara's bed and talk into the silence. I saw the footage, I tell her. You nodded before you did it. I used to love that nod. You'd do it when you made up your mind about dinner or about me. You always looked so sure. The monitor clicks. I imagine she hears me. I want to believe there's still a room in her mind where my voice reaches. I went to see the car, I continue. It's still there, waiting for you to forgive it. The window reflects my face and hers side by side, both pale, both motionless. The fourth line trembles slightly with the hum of the machine. I take her hand. I used to think guilt was a weight. It's not. It's a mirror. You keep looking until you don't recognize yourself. Her fingers twitch faintly. Maybe a reflex. Maybe memory. For the first time, I allow myself to cry. Quietly, so no one has to witness it. Later, as I'm leaving the hospital, Harris texts me one line. "We found something in the glove compartment. A letter addressed to you. It's sealed. You can collect it tomorrow." I stop at the door. The world seems to contract. A letter. Paper again. Her final revision. I whisper into the empty hallway. "You weren't done talking, were you?" Outside, the sleet turns to rain. Sharp, constant, almost musical. Cliffhanger/realization. There was a letter in the car, her voice waiting on paper. The truth may not be over. It may only be beginning to speak. The next morning, Boston smells like thawing snow and car exhaust. I walk to the precinct with a heaviness that doesn't belong to the weather. Detective Harris meets me at the front desk, an envelope already in his hand. "It was sealed," he says. "No fingerprints but hers. Found tucked beneath the insurance card. You can open it here or take it with you." I nod. "Here." He slides it across the table like evidence from a quieter crime. I study the handwriting. Mara's neat, slanted script that always looked like it wanted to stay upright even when the world leaned. I open it slowly, afraid of what air might do to the words. "Daniel, if you're reading this, it means I did something I can't undo. Don't look for villains. There aren't any. Just people who got tired of pretending they were okay. I found the messages. I listened to my own silence afterward, and it was unbearable. I kept thinking about that night we promised to tell each other the truth, no matter how much it hurt. I waited for you to keep that promise. You didn't. I didn't want to scream. I didn't want a scene. I wanted stillness. The crash wasn't about death. It was about stopping time before I became someone I didn't recognize. I hope you remember the song we used to play, the one you said felt like forgiveness. Play it once for me and once for yourself, then let it end. M. I read it 3 times before I can breathe. Harris studies me without speaking. "Do you want to keep it?" he asks finally. It's not